Welcome to you all joining us today from around Australia and beyond our shores for this very special event. I'm coming to you from the lands of the Wurundjeri people of the Kulin Nation, and I want to start by paying my respects to their elders past, present and emerging. And I also want to welcome all First Nations people joining us today and recognise the fantastic work and contribution of our amazing First Nation staff at Mental Health First Aid International. I also want to acknowledge the lived experience of those joining us and affirm how it shapes the contributions we make through our work and in so many other ways. My name is Christian Seibert, and I'm the chair of the board of Mental Health First Aid International. I'm your host for this special event today as we kick off a year of celebrations to mark the 25th anniversary of Mental Health First Aid. The story of Mental Health First Aid began in Canberra, Australia, on the lands of the Ngunnawal and Ngambri peoples in the year 2000. Our amazing and dedicated co-founders, Betty Kitchener, AM, and Professor Tony Jorn, had an idea. We have physical first aid, but why don't we have mental health first aid? An innovative idea is important, but it's only a spark. To translate into real impact, an innovative idea needs to be combined with effort, energy, commitment, and collaboration. Through the work of Betty and Tony, and the work of countless other contributors and partners here and around the world, many of whom are with us here today, a global movement has been built. It began in Australia, and it's now active in 31 countries. It's dedicated to providing evidence-based mental health first aid education for everyone. More than 8 million people have been trained around the world in workplaces, universities, schools, and so many other contexts, because our movement seeks to meet people where they are, aiming to give them practical skills and new confidence to have conversations about mental health and well-being. Because having a conversation with a co-worker, a friend, or a family member, it may change a life, or indeed it may save a life. This is important work that has a meaningful and tangible impact. And today we're going to be sharing stories about that work over the past 25 years and where we can go together in the future. We're also formally launching our strategic plan today, which I'm really excited about. Looking ahead to 2030, it seeks to build on the achievements of the past 25 years as we strive towards our vision of a world where we all have the skills and confidence to support people experiencing mental health problems. It reframes our purpose, making it clear that we're an organisation that is energised and outward looking, and we exist to grow the global movement that's been built over the past 25 years in a way that is dedicated, it is renewed with passion, and it involves working with all our partners here and around the world, with instructors who deliver high quality training in a diverse range of community settings, with researchers who build and grow the evidence base that uniquely underpins mental health first aid, with international partners whose efforts have taken an Australian idea and Australian innovation and enabled it to make a difference in all the corners of the world, with mental health first aiders whom our training supports and empowers, with governments, philanthropic organisations and others whose investments have helped drive the innovation shaped by lived experience that is a hallmark of mental health first aid. Working together can enable more people in more places to gain practical skills and new confidence to have conversations about mental health. Building on 25 years of those empowering conversations, which is our theme for this anniversary year. Our new strategic plan also emphasises our commitment to reconciliation, to prioritising and promoting Aboriginal and Torres Strait Islander mental health and the social and emotional well-being of Australia's First Peoples. And today we're also launching our new Reconciliation Action Plan, or RAP. Our RAP is about pushing our organisation to elevate our practices in support of reconciliation, even if at times this can be uncomfortable. It's about genuine, real action. It's about an invitation for accountability, a request for feedback, and a signal about our openness and willingness to change what we do and how we do it in the service of reconciliation. We're going to hear from a diverse range of speakers today who'll help tell a story about the impact of mental health first aid. Those speakers will share reflections on where we've come from, where we are now, and where we can go in the future together. And I'm really looking forward to what everybody has to say. And I'm so pleased they've been able to join us from here in Australia and all the way over in the United States. But before I introduce our first speaker and welcome our first speaker, I'm going to ask you to watch this short video. We're really pleased to have the support of the Australian government in furtherance of our work, spreading the reach of mental health first aid in the Australian community. And we're so pleased to have this short video from the Honourable Emma McBride, MP, the Assistant Minister for Mental Health and Suicide Prevention.
I'm so happy to celebrate Mental Health First Aid's 25th anniversary. Mental Health First Aid Australia is an Australian success story that began in Canberra a quarter of a century ago when the first course was delivered to a small group. That course was a pioneering step for mental health prevention and early intervention in Australia that has now grown into a global movement. More than 8 million people worldwide, trained in more than 30 countries, who are recognising, understanding and responding to the mental health needs of the community, broadening the safety and support around millions, not just in Australia but worldwide, and making sure more people get help as early as possible. I am proud to be a mental health first aider. As a pharmacist, I know the real difference it makes. This is supported by the Albanese government's reforms for mental health, reforms that provide mental health care to people where and when they need it, through an expanding range and reach of high-quality, free Medicare services and a step system of personalised care. The new National Early Intervention Service offering support for anyone who needs it. Medicare mental health centres offering free walk-in mental health care. Perinatal centres, kids hubs and headspace centres for mental health at every age. And new investments to support and build the mental health workforce. As we celebrate today's 25th anniversary, we also look ahead to a time when everyone can get the mental health support and care they need, and a community where people are supported to get that help as early as possible. I want to thank everyone at Mental Health First Aid for your incredible work you do and the difference you make in the lives of thousands of people in Australia and across the world. Congratulations on an incredible 25 years.
And I now want to welcome our first speaker, somebody I've already mentioned in my remarks and somebody who I've known since I joined the board of Mental Health First Aid International all the way back in 2014. And a person who, along with Betty Kitchener, AM, really has inspired me and inspired so many others with his commitment, with his energy and with his dedication to building this movement from how it started 25 years ago. Tony Jorm was chair of Mental Health First Aid before I became chair over 3 years ago, and he's one of our co-founders. And I'm now going to welcome him to the screen to share his reflections on this story over 25 years. Welcome, Tony.
I'm going to tell you about the story of Mental Health First Aid from the genesis of the idea through to where we are now, where it's a worldwide movement. Many people know that the idea for Mental Health First Aid began on a dog walk, which Betty and I discussed the concept. We don't have a photo of the dog walk because we didn't think it was a very significant event at the time. But we do have a photo of the dog. This is the dog, King. He was a King Charles Cavalier, a stray dog who we adopted from the Lost Dogs home in Canberra. We also don't have a picture of where we had the conversation, but many years later, Betty and I went back and we took a picture at that spot, which is the very spot we had the conversation. We weren't dressed like that at the time. We're dressed in our dog walking clothes. But in this conversation, we talked about why physical first aid courses didn't cover mental health problems, because people commonly learn how to do CPR or to help in various physical health emergencies, but they don't learn to help people who are suicidal or having a panic attack or out of contact with reality. And that seemed to be a big omission to us. Now that's a very unusual topic for a conversation on a dog walk, but there was a context to it all. And I'll tell you about this context. At the left there is a picture of Betty as a teenager. Growing up, Betty faced a number of adversities in her life. And as a teenager, she had a severe episode of depression. She was suicidal. She had a suicide attempt. And at that time in her life, she wasn't well supported by people around her. Unfortunately, youth mental health first aid didn't exist then. People didn't have the knowledge and skills about how to support a young person in that situation. Subsequently, throughout life, she had a number of other episodes of depression, including episodes of hospitalisation. She also trained as a teacher and a nurse, and she used to teach Red Cross first aid courses on the side. So that was her context to the dog walk. I was a mental health researcher. I worked at the Australian National University, and at that time in the mid-1990s, when we had the dog walk conversation, there was a big movement in Australia to try and upskill GPs in mental health, because at the time, the knowledge about how to assist people with mental health problems largely resided with mental health specialists, mental health professionals. And so the movement was to then spread the skills more with GPs. But I felt this wasn't enough, that really we needed a whole of community approach where everybody had some skills. And so with some colleagues in 1995, we carried out this national survey in Australia, and we coined this term mental health literacy. And we published this article that I show there on the right in the Medical Journal of Australia. It would prove to be a very influential article. It's one of the most highly cited articles ever published in the Medical Journal of Australia, continues to be highly cited. And what we found there was that many people lacked a good understanding about mental health problems, and that there were big gulfs between public and professional understanding and thinking about mental health. And so I was primed in the dog work because I was thinking, how can we overcome that gap? How can we upskill the public in taking more effective action? So Betty and I talked about the concept of mental health first aid over subsequent years, and talked about what might be in the course, but we were both busy with our respective jobs and with family responsibilities, and we didn't get very far with it. What made a big difference was that in the year 2000, Betty decided to reduce her paid work and to volunteer part-time to try and get the course going. And that really changed everything. So she worked as a volunteer for 6 months in the year 2000. In the middle of that year, she got a small grant that paid a part-time salary. And then she quit her paid work and she worked full-time on that part-time salary. Late in 2000, she taught the first mental health first aid course. Now, we don't have a photo of that because, again, we didn't think it was a big deal at the time. We had no idea where this would go. But this photo that I show here is the earliest photo I have, which is Betty in the year early in 2001, teaching a course. So there was some rapid progress once Betty did that. Things really moved very rapidly. We really lacked resources to get mental health first aid going, and we got help from a number of people. The slide on the left shows Betty and I with a woman in red whose name is Jenny Thomas. And I had known her as a student when I was a lecturer at Deakin University many years ago. And her husband, M. Thomas, had died by suicide. And Jenny contacted me and said she wanted to do something in memory of her husband. And when she found out about mental health first aid, she donated money, which allowed us to print the first mental health first aid manual. Before that, it had just been photocopied notes that Betty gave to participants. And the manual was provided free for a number of years as a result of a generous donation. The middle slide shows us with a giant check, and I'll draw your attention to the man who's second on the left, blue shirt poking out above the check. His name is Noel Travascus. He was a member of a Rotary Club in Goulburn, New South Wales, and I met him because he and I were speakers together at a lot of a number of Rotary community health forums that were held around rural New South Wales. He had a serious history of depression, and he had good connections with farmers in rural areas because he worked for a fertiliser company, Insight Tech Pivot. And when he found out about mental health first aid, he persuaded the company to auction off trucks of fertiliser to farmers, and the money was used to then give scholarships to train instructors. So this is a photo of the check presentation from the proceeds of the auctioned trucks of fertiliser. Also, if you don't have any resources, the people to call on, of course, are your family members. And we relied very heavily on family members in the early years. The photo on the right shows Betty and I with our children. Our daughter, Ruth, also known as Marley on the left, she developed the first mental health first aid website. We didn't have the skills to do that. And our son, David, on the right, who is a programmer, he developed the first web instructor management system, which became very important in managing once we got a national network of instructors. My brother Peter, who's not shown there, was a lawyer. He gave us an immense amount of free legal help, which we couldn't have done without. My own contribution was as a researcher. I was a researcher at the Australian National University. Betty is also very research oriented. And so from the very first course, we got data from the participants. And once we got sufficient data, we published this article in the journal BMC Psychiatry, Mental Health First Aid Training for the Public, Evaluation of Effects on Knowledge, Attitudes and Helping Behaviour. And we showed that there were positive effects of the training, which is heartening. So BMC Psychiatry is a reasonably well-known psychiatric journal, but what proved more significant is that a journal called the BMJ, which stands for British Medical Journal, which is very prestigious, has a very large circulation. They published a very short piece based on our article called Australians Set Up a Mental Health First Aid Course. And that got enormous attention, including internationally. So the first country overseas that mental health first aid went to was Scotland. And it occurred because someone in the Scottish Executive, which is the Scottish arm of the Scottish government, read the BMJ article and thought this is a good idea for Scotland. So Betty took it over there and trained a cohort of instructors, and it's still going strong there. And Betty also produced a version of Algae with a Scottish costume, who she calls Mac Algae. The second country it went to was Hong Kong. Here's Betty in Hong Kong. This was in 2004. The Mental Health Association of Hong Kong ran out the program there and continue to do so, and they've done a tremendous job. But when Betty was in Hong Kong, the instructor she trained said, you need a mascot, because the Hong Kong people were quite into having, pandas and other furry creatures as mascots. So she thought about it and she came up with the idea we could have a koala mascot, since it was an Australian program. Now, I thought having this koala mascot, which she called Algae after the Mental Health First Aid Action Plan, I thought it was not a very good idea. I thought it was not a priority at all. And I have to say I was totally wrong. It was a very good idea. People love algae, and he gave meaning to the Algae Action Plan, which algae is not a word in English, but it is a name of a koala. A lot of people don't know there was a real algae. I've shown a picture of him on the right. He is a joey whose mother died, and he was raised in captivity. Betty sponsored him to be raised, and then he was released back into the wild, and she asked that he be called Algae, which he was. As well as the early spread overseas to Scotland and then Hong Kong, there was spread around Australia. Where we lived in Canberra, there's a very large rural area of New South Wales, and it had a health area called the Southern Area Health Service. And we talked with the staff there, and we were fortunate to be able to get a grant with them from New South Wales Health to do a large cluster randomised controlled trial of mental health first aid training in rural areas. This is the first cohort of Australian instructors other than Betty. Up to this time, she was the sole instructor. You can see Betty at the back there with the reddish brown hair and the red top. There is another man I want to talk about here, particularly right at the very back, the tall man at the far left. That is Len Kanowski. He's a mental health nurse, and he had been very involved in Aboriginal mental health worker training. He'd set up a program of training in southern New South Wales for New South Wales Health, and later that went to Charles Sturt University and became the Jurawang program, which was run by some of his graduates. Because of Len's interested in Aboriginal mental health, Betty and I said, great, Len, go for it, and he did. So he worked with an Aboriginal expert group to adapt the course and produced an Aboriginal mental health first aid manual and course, and he trained the initial, along with an Aboriginal instructor, trained the first cohort of instructors, and we'll hear later on how that course has gone around Australia, and it inspired Indigenous mental health first aid courses in New Zealand, Aotearoa, and in Canada as a result. Betty and I felt that with the first edition of mental health first aid that it wasn't sound enough in its basis, because we're both very committed to evidence-based practice and we wanted to inform everything that was taught in the course by research. But what we soon found is that there wasn't any research on what a member of the public, a first aider, could do. There's a lot on what professionals could do, but not on first aiders. So we thought this needed strengthening. So we came up with this idea of developing expert consensus guidelines on how to provide mental health first aid. We used the two groups of experts, people with professional expertise and people with lived experience expertise of mental health problems and mental health crises. We applied from a grant from an organisation called Australian Rotary Health, and we were successful. And we employed a young PhD graduate called Claire Kelly to work on that, and she was at that stage also a mental health first aid instructor. In subsequent years, mental health first aid got a number of grants from Australian Rotary Health, and Betty and I were so impressed with the work that they were doing that we actually joined Rotary, and are still very active in Rotary, and Betty's very active in supporting Australian Rotary Health. So through the work of Claire and other colleagues, we developed these expert consensus guidelines, which are printed there as PDFs, and we used those to totally revamp the course. And so in 2010, we got the second edition Mental Health First Aid Manual and Youth Mental Health First Aid Manual, and we felt then they really had a strong basis, that absolutely everything that was taught in that course about what to do, if somebody said, why do you teach that? We could say, it's because at least 80% of health professionals, mental health professionals who work on that area, and 80% of people with lived experience of that problem say that's what we should do. It's not just our opinion. Mental health first aid at first was auspiced by other organisations. It was quite small. That proved to be a limiting factor, and so we then set up an independent organisation in 2011. The photo on the left shows the very first board meeting back then, and it was held a very informal meeting at a restaurant in Carlton in Melbourne. In 2012, the organisation got its own office and the staff moved in, and on the right there's a picture of Betty when the materials had just been moved into the office, and she's there in one of the offices with big algae discussing where to next, what the next task was. After the organisation became independent, two of our younger colleagues developed a new innovation, teen mental health first aid, that developed a course for teenagers to support their peers, both for younger high school students and older high school students. They're Laura Hart, who was a PhD graduate, and also Dr. Claire Kelly. The photograph there shows the teen mental first aid manual, the first edition of it. And the next photograph shows Laura and Claire last year when they got a Life Award from Suicide Prevention Australia for their work in developing that course. And of course, our colleagues in the United States, who are fantastic lobbyists, we have much to learn from them in that regard. They got the pop star Lady Gaga interested in teen mental health first aid, and her foundation, Born This Way Foundation, sponsored its dissemination in the US. And of course, that was big news in Australia as well. Lady Gaga's big news. So you could see the picture on the right shows Claire and Laura on breakfast television talking about the course and giving it national exposure. By 2015, we'd got to the stage we'd had 1 million first aiders. So it took us 15 years to get from 0 to 1 million. this shows Betty cutting a celebratory cake. One of the mental health first aid staff at the time, Sonny, who worked in IT, had a wife, Cherry, who had fantastic skills at cake decoration, absolutely amazing. And she made this cake, which shows algae bursting out of a box with stars. The algae was made out of icing, and around a lot of cupcakes with mental health first aid logo. And then Betty arranged algae with various flags representing the various countries, and it's shown here cutting the cake. So it took us 15 years to get from 0 to 1 million first aiders, mental health first aiders globally. But now we're up to 8 million. So the next 10 years, 7 million were trained. So imagine what it's going to be in the next 10 years, even more. It's going up exponentially. So now we're in a situation of over 8 million, 31 countries, 60,000 instructors worldwide. If somebody could go back in time and meet Betty and I when we're on that dog walk and say, this is what will happen, we wouldn't have believed it. Our vision at the time was to work as volunteers in a community service activity, which is not connected with the work of either of us. We envisaged running 1 or 2 courses on weekends in Canberra, in the city where we lived. We never really thought at the time it would get any bigger than it did. One of the things I find sort of satisfying in thinking about the history of mental health first aid is thinking back to Betty as the teenager and the difficulties she faced back then and how she wasn't well supported. And I think, you know, many people who'll be listening here will have had experience of mental illness in themselves or people close to them. And sometimes through that suffering, you know, new possibilities arise. And I think if Betty had never experienced that, we'd never have had mental health first aid. So I think she created something which means that other adolescents like she was who are going through that will be better supported in the future. So it really had, you know, a positive outcome from what she went through. A few years ago, I put together a list of documents, very large number of documents on the history of mental first aid, and I deposited them in an archive. And although I'd lived through all of this development, when I put those documents together and I saw week by week and month by month what happened, I was just blown away. I thought, how could Betty ever do so much? Oh, here she is, she's coming. Thanks. How could she ever do so much? It was just amazing. It just every month it just seemed to be going on to something new. So I've put some slides here just to show a few of the diverse things she did. The top one shows where she was addressing a parliamentary breakfast in Canada, in Ottawa, Canada. The one at the bottom left shows where she was speaking at a graduation ceremony at the University of Canberra. It shows her with the Chancellor and the Vice Chancellor. The one at the bottom right shows when she trained instructors in Saudi Arabia. You can see at the back in black, you can barely see the women, and the men up front in white. And Betty was allowed pretty well up the front, not quite at the front in the photograph, not always up the back with the women there. But mental first aid in its early years was tiny, and she had to do an extraordinary range of skills to cover it all. It wasn't possible to do the specialisation that people fortunately are able to do now. Although I've named a number of people who are involved in the early history of mental health first aid, I really feel very aware that there are so many people I could have named. There would be hundreds and hundreds of names that I could have mentioned along the way. And I just want to mention all the people in various roles, like the people who are on the board, from the initial board all the way through, the staff who worked on the organisation, many of them from the very beginning to now, various academic collaborators, the University of Melbourne, University of Sydney, people overseas who've done it, various funders who've donated money, the instructors who've really been the front line of it all. And I really admire the instructors greatly, as I know Betty does. And also the first aiders, who are the people who are doing it all. They're the ones who are providing the support. And lastly, our overseas partners, who in so many countries, they've done a fantastic job of expanding the program from 0, and now it's enormous in many countries. It's not all ended. It's still going. It's still expanding. There are a lot of things happening. I'm just going to mention a few of them that that I have some involvement in. The others I'm not involved in, but just to give you a flavour of some things that are happening. I mean, Betty and I have been working with Claire Kelly and Catherine Chalmers from Mental Health First Aid International about a 5th edition manual. And I think we've got some great innovative ideas for improving the manual and the course. Laura Hart and Claire Kelly, who had a very successful training program with teen mental health first aid. I've been working with them on a course of supporting children's mental health, which they're leading. And I think that is a real innovation which will go global. It's really very much needed. I've been working with Betty and a number of other people, colleagues at the University of Melbourne, colleagues in China, on mental health first aid for supporting middle income countries, a different approach to the course for countries where they don't have the resources of high income countries in terms of mental health services. And also with staff at Mental Health First Aid, University of Melbourne, University of Sydney on AI. Many of you would have used ChatGPT, and we've been looking at AI chat bot for assessing mental health first aid skills so that people can perfect their mental health first aid skills, practicing on the chat bot after they do the course. And there'd be a lot more that I could mention that is happening, and a lot more that I'm sure I don't know about globally. So I think we're going to see even greater expansion over time. But we all know the need is very great for all of those of you who've contributed, which many people listening will have and will be continuing. I want to thank you for your contribution.
Thank you so much, Tony, for sharing that story, the personal aspects of the story, the photos. Some of it I've heard from you before, but some of it new as well. It's an amazing story about how an innovative idea grounded in real lived experience from day one, how it diffuses. And I have to admit that every time I go on a dog walk with my partner, I feel a little bit of pressure given where things started in that first dog walk and where things have gone since then. And thank you, Betty. You made a brief appearance there and it was heartwarming. But your contribution, your work over so many years has been so much more than a brief cameo. You've been centre stage. And I want to thank you for your contribution, for your work, Betty, and for sharing your lived experience today as well, through Tony, again showing that what we do is really grounded in lived experience. And thank you to all the people who have contributed, as Tony mentioned, people like Claire and Laura and so many other people here and around the world, to this amazing story of 25 years. And now to our next speaker. I have the pleasure of welcoming Ebony, our Executive Director of Australian Operations. So Ebony leads the teams responsible for our Australian mental health first aid program, including overseeing our systems, delivery, instructor training, courses and compliance, program relationships and implementation. It's a big job, and Ebony's going to talk about our strategic plan and a few other important things. So welcome, Ebony.
Good morning, everyone. My name is Ebony Whitehouse, and it's an incredible honour to stand before you today to celebrate this monumental milestone, 25 years of mental health first aid. Today is not only about reflecting on our journey, but also about looking to the next chapter of growth, impact, and collaboration. Before I go any further, I would like to share my deepest thanks to Betty and Tony. Their insights serve as a powerful reminder of the impacts grassroots idea can nurture the right balance of research evidence. These core values have driven mental health first aid and the foundation for everything that we do. From its humble beginnings in Australia, mental health first aid has grown as an opportunity across the globe. We have now trained over 8 million people in 31 countries, and we are supported by more than 60,000 instructors who have been trained worldwide. And here in Australia alone, we have trained over 1.5 million people, supported by a network of 3,200 passionate instructors. Every single one of you, whether you're a mental health first aider, an instructor, a partner or supporter, has contributed to this extraordinary achievement. Together, we have built something truly impactful, and today we celebrate all of you who have made it possible. As we look ahead, we also want to take a moment to thank our international partners. Your commitment has been invaluable in expanding the reach of mental health first aid to new corners across the globe. By building the capacity of local communities and ensuring that mental health is prioritised in everyday conversations, You've not only made a tangible difference, but you've also fostered a global movement where people are empowered to respond with compassion and understanding. You've helped make mental health support more accessible, breaking down barriers and opening doors for conversations that can truly change lives. Your hard work, dedication, and belief in this mission are the backbone of Mental Health First Aid's global impact, and for that, we are deeply grateful. Together, we are making the world a more supportive place, one conversation at a time. As we reflect on this progress, we must also look forward to the future, and let me tell you, the future is incredibly bright. We have just launched our 2030 strategic plan, a roadmap that sets our sights on a new chapter of growth, innovation, and collaboration. Our focus is clear. The pillars of our plan are centred on everything that has made Mental Health First Aid successful so far and will drive us forward with even greater momentum. Research, quality, and innovation, ensuring Mental Health First Aid remains evidence-based and responsive to emerging needs. Global impact, expanding access and strengthening international partnerships. Local reach, mobilising the mental health first aid community to reach more people in communities across Australia. Aboriginal and Torres Strait Islander peoples, embedding cultural safety and First Nation leadership in our work. Lived experience, ensuring those with lived experience at the heart of what we do. Public policy and advocacy, driving whole of system reform that embeds mental health first aid in workplaces, schools, and communities. And sustainability, securing the future of mental health first aid through strategic investment, partnerships, and social responsibility. A key focus of this strategic roadmap is ensuring that mental health first aid reaches even further. By 2030, we aim to train 3 million Australians in mental health first aid and 12 million people worldwide. But this just isn't about numbers. It is about ensuring that people who experience disproportionately high distress and suicide rates, such as Aboriginal and Torres Strait Islanders peoples, young people, veterans, and many others, have the access they need. Real lasting change requires collaboration. We must embed mental health first aid in our communities, schools, and workplaces. We will work tirelessly with governments, peak bodies, and the sector to see mental health first aid as a standard inclusion in early intervention and prevention. We are already seeing positive change through programs like Health Professional Students and Mental Health First Aid Protect, which work with national agencies and organisations to deliver mental health support at scale. Our goal is to make mental health first aid as commonplace as physical first aid. We know that when we intervene early, we make a difference and ease the burden on our health systems. Our new strategic plan is ambitious, but I am confident that with all of you by our side, we will achieve it. Together, we will continue to adapt and grow to ever-evolving mental health needs of our communities. Part of this growth is renewed commitment to First Nation communities, ensuring that culturally safe and responsive programs are integrated into all of our work. Our new strategic pillar is focused on expanding culturally capable and responsive programs and the workforce to support the unique needs of Aboriginal and Torres Strait Islander peoples, increasing cultural capability within the organisation, and ensuring that Aboriginal and Torres Strait Islander mental health and wellbeing is a top priority at all levels of our organisation. With that in mind, today, we are proud to launch our Reconciliation Action Plan, which will guide how we embed cultural safety, collaboration, and leadership by Aboriginal and Torres Strait Islander peoples into all that we do. We know that social and emotional wellbeing approaches are essential in supporting First Nations mental health, and this RAP reflects our deepened commitment to walking alongside communities, listening, and taking meaningful action. I'm so pleased to have Karen Bates, who leads our Aboriginal and Torres Strait Islander mental health first aid programs, along with Margaret Saunders of our Instructors Reference Group, here today to talk about the impact of the program in supporting the social and emotional wellbeing of Australia's First Peoples. With the launch of this RAP, our organisation has made a commitment to ensure the social and emotional wellbeing of all First Nations people is not just supported by the great work of our Aboriginal and Torres Strait Islander mental health first aid program, but is a core part of our work across all that we do. As we look ahead, we have some exciting events coming up. From our Mental Health First Aid Day of Action in May to the International Mental Health First Aid Summit in June, our 25th anniversary gala dinner in August, and the National Instructor Summit in September. These events will be key opportunities for us to come together in Australia and internationally. They will allow us to strengthen relationships, raise awareness, and continue spreading the message of mental health first aid. Together, we have the power to change the narrative around mental health and ensure that people everywhere are equipped with the skills and confidence to support one another when it matters most. But today, as we celebrate this 25th anniversary, I want to turn it over to you. I want to ask each of you to reflect on your why. What brought you to this movement? What inspired you to become a mental health first aider, an instructor, or a partner? Your passion and commitment and personal stories are what drive this movement forward. They are the reason we are all here today. So I invite you to share your why with us. We would love to hear your story as we kick off the next chapter of the mental health first aid journey. Whether you've been with us for years or just joined, your contributions are invaluable. Together we are making a profound difference in the world. Thank you to each and every one of you, our mental health first aiders, instructors, partners, researchers, and those with lived experience. You are the reason we are here today, and because of you, we will continue to change the world one conversation at a time. Let's keep building this momentum. The best is yet to come. Thank you.
And now I want to welcome our next speaker, Tremaine L. Amin, who's the Vice President of Mental Health First Aid USA at the National Council for Mental Wellbeing, America's peak body for mental health. As a mental health equity advocate, Tremaine oversees the development of wellbeing programs and has played a key role in the National Council's work and achievement, training over 4 million people in mental health first aid in the United States. It's an amazing achievement that has touched so many people's lives in the United States. We had the benefit of meeting and engaging with Tremaine and Chuck, the president of the National Council, when they visited Melbourne in August last year. And they even got the opportunity to go and check out the koalas at Hillsville Sanctuary, where Algie's family members live. And we're really looking forward to going to the Mental Health First Aid Summit in Philadelphia in May as part of our celebrations for this 25th anniversary year.
Well, thank you so much for having me, Christiane. I am so excited to be joining you today. And I will say, in the remarks that we've heard thus far, I can't help but just be so proud to be part of this community. Community is actually one of my favorite words, and this has been 25 years of empowering conversations across community. I'm so grateful for all of the individuals and organizations that have brought us this far to 25 years, and we can't wait for the next 25 years to come. I'll just say that if I think about the word community, I think about just the journey that we've been on together. While we've dedicated our work and our efforts here in the United States to not only addressing mental health and substance use challenges, but making sure that receiving the help and the support that's necessary to address those mental health challenges is a reality for everyone. And so as part of that, here at the National Council for Mental Wellbeing, we decided in 2008 to launch more broadly across the United States. In the next slide, you'll see that we have this timeline around how we got here. And we got here through community. That community connection is the way that we've empowered every state across the country to reflect on how they might continue a conversation within their workplaces, their schools, and even within their homes. So one of the things that I want us to pay attention to is the fact that we have innovated over time. One of the things that we thought was really important is not only to address the needs of adults, but you'll notice that we've brought not only mental health first aid for adults, but also youth mental health first aid in 2012. Prior to that, we connected the dots between all of the work that was going on in our organization to support the advocacy and policy efforts nationally, to how we might ensure that communities can support mental health first aid in their communities themselves. And so one of the things we've done is to advocate to have more funding available for more workplaces, schools, and communities. And that those efforts meant that we could then innovate on the development of new ways to reach individuals with content that really resonated with them. To that end, we've created mental health first aid for multiple populations, including our active duty and veteran service members and their families, law enforcement, rural communities, as well as translations that have been part of what we've done in Spanish, Korean, and Khmer across that time. This effort would not be possible without a wonderful team of individuals who've dedicated themselves to going from 3 staff members dedicated to mental health first aid in 2008, and now more than 70 staff that support the efforts of mental health first aid here in the United States. I give that metric because they are the engine that allows us to keep going, along with thousands of instructors, in addition to our national trainers and to first aiders who advocate in their own communities for more available resources to make mental health literacy a reality everywhere. Schools have really been also a significant and positive impact through mental health first aid as we've grown the program with many states and organizations deciding to ensure all of their teachers or staff are trained in mental health first aid and youth mental health first aid specifically, making sure that we're addressing the needs of our young people in our country. What we also saw over time is that in workplaces, we wanted to adapt the content to really serve the needs of individuals who were seeing their coworkers or leaders struggling and needing to have that support. So the opportunity was to take the content that was so wonderfully researched and that evidence base that existed, and then expand that to really meet the needs of workplaces nationally. That means that we've worked with so many notable companies that are not only based in the US, but globally, to really teach employees how to recognize and respond to colleagues who might be experiencing mental health or substance use challenges. So those communities, that opportunity to make the connections between what we do at home, at school, and at work is how we've been able to grow. It's through the work and the dedication of our teams, but it's also through the opportunities that have come by making mental health first aid available to communities through policy and advocacy. We've seen our road expand over time. We've seen the need to really help people understand that the more individuals that have access to information, the more we can ensure there's access to mental health services and to the supports needed for folks to connect to the resources and the treatments available in their communities. We have a goal. And we have a goal in being in this global community with everyone. And much like the goal around our strategic plan internationally, we have a goal to reach 22 million people in the US, and we can do it. I'm really confident because we've gotten just last year to 4 million people trained. We are 4 million strong. And we also found out that we have about 15 people, some research demonstrates, in our closest circle of friends, which means that if we train 1 in 15 people, that 22 million will have an impact of more than 60 million heartbeats across the country. So we are so excited to work alongside our members who serve mental health, serve individuals and communities through mental health and substance use services. And we're so excited to work alongside the more than 15,000 active instructors in the US to really deliver this critical program so that individuals like you and like me have the opportunity to just to hold that hope for others as we move forward. We've seen such a demand in the need for mental health training in the last few years. And I'm sure that impact you've seen as well. And so I just want to go to the next slide and talk about how we're excited to celebrate this impact of 25 years through the summit that we're having on May 4th, as was mentioned. And in the next slide, you'll also see that we have our annual conference where we have more than 5,000 folks join us from across the country, those that are providing the critical services necessary for mental health and substance use care in the US. Those providers join us to celebrate the progress we've made and the road ahead. And so we're excited to have this as part of this global celebration. And I think that the last thing that I want to say is that we need you as a part of that. We need you to continue to advocate, to continue to spread the word and the message of hope that mental health first aid brings. And I'm so grateful to be in community with you, because community looks like us. It looks like all of us together, just envisioning what the next 25 years can be. So thank you for being the difference in the lives of everyone that you have already touched and those that we have yet to connect with. We're so excited to continue empowering this conversation in every community, everywhere.
I want to welcome Karen, our Executive Director of Aboriginal and Torres Strait Islander Mental Health First Aid, of our Aboriginal and Torres Strait Islander Mental Health First Aid program. A proud Barkinjiwun, Karen is deeply passionate about improving the mental health and wellbeing of Aboriginal and Torres Strait Islander communities. Her work ensures the delivery of culturally safe and informed mental health first aid programs to support the social and emotional wellbeing of Australia's First Peoples. And Karen, together with Lynette from our team, led our RAP development process, a working group which I was pleased to serve on as a board member, together with other staff. And I'm really pleased that Karen's able to join us today to speak about that work and the other work that she leads. Thank you, Karen.
Today, I'd like to share with you the impact of the Aboriginal and Torres Strait Islander Mental Health First Aid program and how we're working together to make a difference in promoting our people's social emotional wellbeing. Our work is grounded in a holistic strengths-based perspective that respects and honours the cultural richness of Aboriginal and Torres Strait Islander peoples. As Australia's First Peoples, our Aboriginal and Torres Strait Islander communities experience significantly poorer mental health outcomes compared to non-Indigenous populations. Our families experience higher rates of psychological distress, increased rates of hospitalisation due to mental health related conditions, and a suicide rate more than twice that of non-Indigenous population. Despite investments like Closing the Gap, significant disparities remain, and the impact of colonisation and intergenerational trauma are ongoing factors that shape mental health outcomes for our peoples. While the gap in mental health outcomes for First Nation peoples continues to widen, there is a growing recognition of the strength and resilience within our communities. This is why the Aboriginal and Torres Strait Islander Mental Health First Aid program is more critical than ever in supporting healing and wellbeing. We know that social emotional wellbeing plays a crucial role in keeping us strong or contributing to our struggles as Aboriginal and Torres Strait Islander peoples. Our wellbeing is deeply influenced by social determinants, racism and disadvantage, which often complicates how we view mental health. We need a balance between focusing on the illness and recognising the importance of healing and wellbeing. Aboriginal and Torres Strait Islander peoples have been around for tens of thousands of years. Our people have knowledge and healing practices that have kept us and continue to keep us strong and well. Our approach is holistic and strengths-based, prioritising the strengths within our communities and the wisdom and resilience that have been passed down through generations. This is why many communities have a positive focus, future-focused philosophy that prioritises healing and wellbeing, ensuring the continuation of cultural practices and knowledge that support mental health in a way that is uniquely our own. For almost 18 years, the Aboriginal and Torres Strait Islander Mental Health First Aid program has been empowering individuals and communities to take action on mental health in a culturally informed way by equipping instructors with the skills, knowledge and confidence to draw upon their own local cultural knowledge to deliver mental health first aid courses, which gives the training meaning and purpose. Currently, we have 2 core courses and 3 specialised courses, and our new Youth Yarns course for young people, supporting young people, soon to be released. Across the 18 years, we've trained over 1,000 instructors, with 295 currently active. These instructors have gone on to train over 35,000 mental health first aiders across the nation. These figures are part of a larger commitment to making mental health support accessible and culturally relevant for First Nations communities across Australia. You see here a map of Australia. It gives you a bit of a snapshot. It talks to the reach of the program. It's indicating where over 7,000 courses have been delivered across Australia in urban, rural and remote areas. Before I'd finish, I'd like to thank the curriculum developers, the Aboriginal and Torres Strait Islander mental health first aid instructors and mental health first aiders, and all who have contributed to the success of the program over the past 18 years. We look forward to continuing to build relationships with Aboriginal and Torres Strait Islander organisations, communities and leaders, and working with you to ensure all Australians have the skills and knowledge to support mental health in a culturally informed way. Thank you for your time and your dedication to this important work.
I'd now like to welcome Margaret, a proud descendant of the Wongaybon people of the Bogan River from the Wiradjuri Nation. An Aboriginal and Torres Strait Islander mental health first aid instructor and principal master instructor, Margaret has delivered courses across Australia. Through her lived experience, she is able to effectively relate to her participants in ways that show cultural integrity, respect and understanding. And we're really pleased to have you here, Margaret, with us to share your story.
Thank you very much, everyone, for selecting me to provide a little bit of a story about my journey as an Aboriginal and Torres Strait Islander mental health first aider. I'd like to acknowledge where I'm coming from the Yugambeh speaking people of the Canberra Nation on the Gold Coast. I'm very privileged to live here and be accepted by the traditional custodians of the land. I'd also like to acknowledge and recognise the traditional owners from everywhere everyone is coming in from for this platform. And also recognise our past, present and emerging elders. Without our past elders, we wouldn't have what we have today. And our present elders are fighting the fight for us still, assisting to develop the mental health program to keep going and be delivered in many, many areas of Australia. And then, of course, our future leaders. Just a brief introduction of myself, just very briefly. I could talk all day, but I'll just do a bit brief one. It's Margaret Saunders Nee Grant. I identify very strongly through, as you mentioned, the Wongaybon people of the Bogan River, part of the Wiradjuri Nation, the bigger nation. And I'm a mother of 9 children, and my children identify very strongly as the Gunditjmara people from down in Victoria. And my partner of 22 years is Cookie Yalanji people, my second partner. I became an instructor, an Aboriginal Torres Strait Islander mental health first aid instructor, because I worked in the native title area for over 20 years, and I saw what it was doing to Aboriginal Torres Strait Islander people with their social and emotional well-being, and then obviously their mental health was being affected. But I believe that I'm a very passionate and committed person to what I do, the work that I do, the courses that I deliver. As mentioned, I'm a principal master instructor of the Aboriginal and Torres Strait Islander mental health first aid, but I deliver the youth Aboriginal and Torres Strait Islander mental health first aid and many of the other programs. And we have other programs coming being released, and I'm going to be becoming an instructor of those. But I believe that the work that I do, I'm coming in and being an instructor, I can make a difference and try and assist and encourage and support Aboriginal and Torres Strait Islander people of feeling comfortable to have a yarn or talk about some of the issues they might be dealing with due to intergenerational trauma, other traumas that they've gone through, stolen generations, removal from their lands, from their cultures, and not being able to practice their cultural and spiritual ways. The list goes on. So I thought that I might be able to assist with delivering the program and being able to deliver it in a way that I can make a connection because of understanding my culture and what I've been brought up with my culture. I mean, I have non-Indigenous culture also, but I was brought up very strongly with my Aboriginal and Torres Strait Islander culture. And that setting the scene of a workshop, to making it culturally safe for Aboriginal and Torres Strait Islander people to express their feelings and maybe look for those early warning signs and symptoms that they might be experiencing, but also touching on the social and emotional wellbeing, a very important part that we can talk about, and encompassing the cultural and spiritual wellness is looked after, because if that certainly isn't looked after, we can start moving into having some quite serious mental health problems. Moving on to the importance of delivering in a culturally safe way. Well, I've already mentioned a little bit about that there, but I feel that the structure of the Aboriginal and Torres Strait Islander mental health first aid course appears to be developed with considering the cultural and spiritual aspects, like I've just mentioned, and utilising the social emotional wellbeing predominantly as the important aspect. So that's the first part of the 2-day course, and it's the social emotional wellbeing and mental health in communities. And we've already talked about how important it is with communities and working with communities for Aboriginal and Torres Strait Islander people. It is vital that an Aboriginal and Torres Strait Islander instructor is able to set the scene, make a safe environment, be culturally aware, making it culturally safe, have the cultural sensitivities of following the cultural protocols for each community, realising that every community has their own unique ways of their cultural practices and issues that are going on in their community. So how you deliver the program is being aware and focusing on those issues with the input of the participants. But you can only get the input of the participants by the way that you deliver a program. That's how I feel anyway, and that's certainly how I deliver my workshops and try to do the best that I can. Hence, I also ensure that I've established, from the beginning of the course, I try to build a rapport, if not already made a bit of a connection with someone. Being an older female, I've travelled a lot, got lots of connections, lots of networks. Having 9 children, which I know is probably not many these days, or for the Aboriginal and Torres Strait Islander families, but it was a lot for me. But I was able to make and establish great, strong connections with my children's extended friends and family. So once I build a rapport and connection, I'm able to then move into creating the environment for discussions. And then talking about my own lived experience and what I've been through, and I'm still going through today. So I can make that connection, and certainly participants will come up to me and thank me very much for sharing my story, and then they feel like they can share their story, which is a really important thing for Aboriginal and Torres Strait Islander people to be able to do, because that stigma and shame that they've certainly experienced for many, many, many years. If we can break down those barriers and they can come and have a bit of a yarn and talk about some of the social, the mental health issues that they might be experiencing. Many courses, programs and workshops may address complexities regarding social emotional wellbeing, mental health and crisis situations. But the Aboriginal Mental Health First Aid program has been tailored for Aboriginal and Torres Strait Islander people to be instrumental in removing, like I've just already mentioned, stigma and shame as a barrier to seeking help, as it was since once seen as taboo to ask for help or even to talk about suicide, let alone talk about self-harm, non-suicidal self-injury. And we're certainly finding out that is still part of the reasons why Aboriginal and Torres Strait Islander people are not seeking help, or not talking to anyone, and not trying to find out where they can go and get some help. All of those barriers there, the Aboriginal Mental Health First Aid course can certainly assist by letting them know there is help there, and encouraging and supporting them to talk to someone and go and get find some help for them. I believe the language that we use in the Aboriginal Mental Health First Aid Aboriginal and Torres Strait Islander mental health first aid course is appropriate, but sometimes we've got to just dig deep and just in the way that you present it, use a little bit of a gentle language, but that you'll only know that if you could have your participants feel comfortable to ask, oh, what do you mean by that? And then expand it a bit more. And then, of course, if we're talking to remote communities where, English is their third and fourth language, we bring interpreters in, or we have other people in the communities to explain things. And I've certainly experienced this in many of the communities and remote communities that I have delivered the Aboriginal and Torres Strait Islander mental health first aid. Okay, so certainly very important that we, as trainers, that we are aware of all these issues that I have mentioned. A key moment for me that impacted me very much amongst the many programs that I have delivered across Australia is when I delivered a workshop for the prisons. I delivered to a couple of prisons in New South Wales, but in particular one prison where I delivered to the females, one session to the males, a couple of sessions with another male instructor. And the young gentleman came up to me afterwards who was incarcerated, and he said he wanted to thank me very much for sharing my story. I lost my son, one of my sons. I have 5 daughters and 4 sons. My 8th child, my son, my 4th son, he was suicided 6.5 years ago. So I just share in the suicide session a little bit about, what my lived experience is. And then he thought that helped him because he couldn't talk about losing his brother to suicide. So now after the course, he said he felt like he needed to open up about it and talk about it, go and maybe see someone, gets professional help, but then encourage others to talk about it, to not bottle it all up and not see someone and talk about things that might help him move on with losing his brother to suicide. Because as we know, the suicide rates are very high for Aboriginal and Torres Strait Islander young males. The impact of when I share my lived experiences and my cultural knowledge, this connects and resonates with many participants and encourages them to, like the young fellow that I've talked about, share their own stories, share things that have happened to them, share things that they're going through. So it's really important to try and encourage them as best you can to open up and have that yarn with you. I tried, and I hopefully I do it, well, I think I do, with the feedback that I receive, is I attempt to create that safe space and an environment for everyone to be able to share their stories, their journeys, and talk about what their issues are happening in their community, in their lives. I deliver across board to remote communities, to communities not so remote, to urban areas, to city areas, to government organisations, non-profit organisations, Aboriginal organisations. The list goes on. Schools, because with the youth, Aboriginal and Torres Strait Islander mental health first aid, youth organisations. So all of the workshops that I deliver, I believe that I'm able to talk about my lived experience and show that I am trying to assist with them becoming an Aboriginal and Torres Strait Islander mental health first aid instructor, so they can go back to their communities, to their workplaces, and deliver the program. We certainly have many people that have decided to become instructors from attending the 2-day workshop. And obviously you can see by my passion, which hopefully I've been able to express in an appropriate way, is I have a sense of feeling whole, feeling that I'm doing something to help my community, Aboriginal and Torres Strait Islander people, and other non-Indigenous people that work with Aboriginal and Torres Strait Islander people, to understand and work out different ways that they can maybe relate in a culturally appropriate way, and without being judged, or listen and listen and communicate non-judgmentally, and assisting and supporting and encouraging wherever possible to go and seek some help. I certainly, if I can just share with my lived experience, I certainly followed algae. I believe very much in algae to try and save my son, but unfortunately it didn't happen. But I still have other issues in my life that I'm still dealing with. So all of my training and my work that I do is part of my healing journey, but I certainly am trying to do the best that I can for everyone. Thank you very much for listening to me. And
I wanted to now introduce Chris, who's chair of our inaugural National Instructor Reference Group that was formed last year, and also a newly appointed member of our board's Quality and Risk Committee, which reflects our commitment to embed instructor perspectives into our governance structure. With over 20 years of experience in mental health, Chris brings extensive expertise in policy, strategic planning and leadership. And as a master instructor, he's worked with diverse communities, including people with disabilities, carers, and Aboriginal and Torres Strait Islander peoples. So thank you so much, Chris, for joining us today.
Thanks, Christian. It's an absolute pleasure to be here this afternoon. If it wasn't already apparent from what people have mentioned, it's just inspiring to hear people's perspectives and people's journey, and just the hard work that's gone into getting mental health first aid to where it stands 25 years after its inception. So again, absolutely humbled to be part of it. So I've got the pleasure this afternoon of just walking through some of my reflections as an instructor. And like Christian said, as being the chair of the inaugural Instructor Reference Group, which is a awesome addition that Mental Health First Aid have put in place. So just to begin, again, it goes without saying 25 years is just an incredible milestone for any organisation. But for Mental Health First Aid, it's especially significant when we think about how it shaped vital conversations and created pathways for support, while assisting individuals and communities to take proactive steps in improving mental health and wellbeing. So as we all gather this afternoon to reflect on these 25 years, it's essential to recognise that the key conduit and lifeblood of mental health first aid across this country and also internationally is our instructors. It's their dedication that ensures that the course continues to thrive, reaching over 1.5 million people in Australia as of December 2024. As was mentioned in one of the earlier presentations, today we now have 3,292 current instructors in Australia and 60,000 active globally, which is amazing. Over the years, our numbers have grown steadily, with many of our instructors having been with us for 5, 10, even 15 years or more. So it's heartening to see that in the past 3 years, a new wave of instructors have joined, and they bring fresh energy, industry experience, and diverse life experience to the table. And this mix is key to keeping the course relevant and accessible across various sectors. And the recent stats show that participant feedback for the majority of instructors is overwhelmingly positive. As instructors, we've made significant strides, especially in workplaces, educational settings, and helping to build the skills and approaches of primary and tertiary health professionals, and shaping and leading important conversations with community organisations, non-government providers, and in most recent times, the Mental Health First Aid course is tailored to support those working with veterans and also emergency services and first responders. On a personal note, I'm honoured to have now been a mental health first aid instructor for the past 15 years. This course has been a constant for me, whether I've been working in primary care, the mental health sector with GPs, allied health providers, families and carers, in leadership of multidisciplinary teams, and in regional and national planning. And if I had to pick a key memory that stands out, it would be mental health first aid training that was delivered to a group of general practice nurses a few years back. A week later, when we reconvened for session 2, several of them shared how they'd used what they'd learned to support patients during that past week. Their communication and confidence in discussing mental health with GPs had grown, and in one instance, they were able to effectively manage a crisis through the use of the Mental Health First Aid Action Plan. The key message from these nurses is that they had never done a course before where the material was so readily transferable and impactful to their day-to-day work. That moment truly reinforced the importance of the course and the work that we all do. Most recently, I've had the pleasure of chairing the inaugural National Mental Health First Aid Instructor Reference Group, which is made up of a diverse group of experienced instructors from across the country who meet monthly to ensure that instructor voices and perspectives are heard. We also discuss key improvements, suggest innovations, and identify ways to improve communications and engagement with instructors nationwide. It's an exciting time, and I'm proud of the work that we're all doing to shape the future of mental health first aid. So with all of this in mind, I want to take a moment to celebrate the success of the Mental Health First Aid course over the past 25 years. It truly has revolutionised mental health education and support in Australia and beyond. So as we look to the next 25 years, I'm filled with excitement and hope for what's to come. The work that we're all doing is only getting more important, and I'm confident that together we will continue to make a lasting impact. Happy 25th anniversary Mental Health First Aid, and here's to the future. Thank you.
Maddie Murrett is a mental health first aider who works in the tech industry. She's a passionate mental health first aider who's proud to be part of the Mental Health First Aider Advisory Group that was formed late last year alongside 9 other mental health first aiders who are committed to helping us lead this movement. We're about giving people the skills and confidence to have conversations about mental health. And those people who have those skills, I'm one of them, having done the course a number of times, they're our mental health first aiders, and we're really passionate to have their input, have their contributions guide our work over the coming years. So over to you, Maddie, to share your perspective and your story. Thank you.
Hi everyone, my name's Maddie. I just wanted to quickly thank everyone for all the words that they've shared, both in the comments and the speakers. It's been wonderful. There are a few things that I'm really proud of being. One of them's a woman, a sister, a friend, a creative, a First Nations person, and of course, a mental health first aider. I've always been passionate about mental health because I've seen firsthand how it affects every part of your life, your relationships, your work, and even the way you see yourself. When your mind isn't in a good place, everything else feels so much harder. The problem is, so many people still believe that asking for help is a sign of weakness or something to be embarrassed about. That mindset is everywhere, and for the longest time, I thought the stigma around mental health was going to be too big to break. But becoming a mental health first aider completely changed my perspective on this. The training isn't just about knowing how to support someone in the moment. It feels like you're joining a global movement, a team of people working together to break the stigma and make real conversations about mental health more common. Every time you use your mental health first aid skills, you're not just helping one person, you're contributing to something bigger. It's like a collective win for the entire mental health first aid community. The more people who get trained, the more support is out there for people who need it. And that's the goal, right? To make sure that no one feels like they have to struggle alone. I've personally seen a lot of people close to me struggle with their mental health for a long time. My mum was the biggest example of this. She was a single mum living 7 hours away from her support network. When things got bad, I felt really helpless. It is really, really hard to watch someone you love go through that and not know how to help. But seeing it up close also taught me something really important. Having the right support can make all the difference. Now, working in the people team at an IT company, I've realized mental health can be tricky to talk about. In fast-paced environments with so many people working remotely, it can be really easy to miss when someone's not okay. That's why mental health first aid is so important. It helps bridge that gap, start conversations that matter, and remind people that they're not alone, even if their office is just their couch. With this training, I've learned how to recognize when someone might be struggling, and more important, how to respond in a way that actually helps them. It's a completely different experience when you know you're equipped with the right words and have a stash of resources behind you that can genuinely make a difference in people's lives. No mental health first aider thinks that they can or should fix or heal someone. That's not what it's about. It's about being there in those tough moments, offering support and helping people feel seen and heard. Sometimes it's just about creating a space for an honest conversation. Other times it's about guiding someone towards the right help. But either way, knowing you can do something instead of feeling helpless, makes all the difference. And that's why every mental health first aider matters. We're not just helping individuals, we're changing the culture around mental health, one conversation at a time. The more of us there are, the closer we get to a future where no one feels ashamed to talk about mental health or ask for help, and where mental health is taken as seriously as physical health. But for that future to happen, we need more people to step up, get trained, and be a part of this movement. It's not just about having the skills, it's about using them, sharing what we know, and encouraging others to become mental health first aiders too. The more we talk about mental health first aid, the more we normalize it, and the more people that we can reach. Every single one of us has the power to make a difference, not just in our workplaces, but in our communities, in our family, and in the lives of everyone around us. The more we spread the word, the more support there is for those who need it. I am so incredibly honoured to be a part of the Mental Health First Aid Advisory Group. This group of talented and knowledgeable people has been such an inspiration to me, and I've learned really so much from them. The Mental Health First Aid team, especially Kaylin and Nicole, have been instrumental in shaping the way I see and use these skills. Having the tools and support to help people would have been enough, but being able to learn from them, contribute to the space, and play even a small part of helping mental health first aid grow, evolve, and flourish has been just the massivest privilege for me. Mental health first aid isn't just about the training, it's a movement, and I couldn't be prouder to be a part of it. Thank you.
Thank you, Maddie, and we're so pleased that you're so proud to be part of this movement as a mental health first aider. And thank you for that call to action about how all of us can make a difference by being trained in mental health first aid, by encouraging somebody else to be trained in mental health first aid. And we can make a difference in that way because, as you said, Maddie, every mental health first aider matters. And that's why we want to grow our reach, not because it's growth for growth's sake, but because every additional person who has new skills, new confidence, the conversations they can have about mental health with somebody, the support that they can provide, the empowerment that they can feel, it can make a difference to a person's life. It can change their life, or indeed, it could save their life. So thank you so much for sharing that story and for drawing on your personal lived experience with your mum as well, and about how it made you want to have the right skills to provide support to make a difference. And also for sharing your perspective on how it helps you in your workplace, given that's where a lot of mental health first aid training occurs. Thanks again. And thank you to all of our speakers and to all of you joining today. I feel really inspired and energized by the stories shared by Tony, Tremaine, Margaret, Karen, Chris, and then just before Maddie. And I feel excited about where we're going as an organisation and as a movement, which Ebony also talked about when we talked about the strategic plan and our wrap. It is an exciting time, and it's an exciting year to celebrate where we've come from, as Tony spoke about so eloquently, where we are now and where we can go together as a movement. We've talked about all the different events and celebrations that we've got on this year, including here and around the world. And we're not celebrating just to give ourselves a pat on the back and just to feel good and leave it at that. We're celebrating to inspire each other, to energize each other, to take where we've been, where we are now, and think about and do the work that can take us to new places going forward, so more people have those skills, have that confidence to have conversations about mental health. Now, we're going to put a slide up just now with a campaign that we're going to be launching. What's your why? Now, as we've seen today, we all have a story, a reason, or a moment when we realised our passion for mental health and supporting others. I have one too. I have lived experience myself of mental illness, and it's what encouraged me to respond to that advertisement seeking board members all the way back in 2014. And what got me to where I am now as chair of the board of Mental Health First Aid International. We all have stories, and those stories are really important. And this campaign, What's Your Why, is about encouraging you all to share your reason why in a short 30-second video. So following up from this event, we'll be sending an email to everyone who's registered with a recording, with some resources and more information about this campaign, which is part of our 25th anniversary year. And we encourage you to all share your stories like you've been sharing them in the comments today. So to finish up, I want to say once again, thank you so much to all of our speakers. Thank you so much to all of you joining us online today. And I want to say thank you to our team members here who've put this event together. There's a lot of hard work that goes into these events, and I really just want to thank them for their work and their professionalism. So thank you. I hope you have a great day, and I look forward to celebrating our 25th anniversary together throughout the year and seeing you at different events and gatherings. Thank you.